Introduction to systems for analyzing verbal interactions. Have you written that one? Eh? The system for analyzing interaction, verbal interaction. Eh. Pajani ba rimba budia pa course outline. Introduction to system for analyzing verbal interaction. Introduction to system for analyzing verbal interaction. So here we are very much interested in the verbal interaction. Verbal interaction. Verbal interaction in the first place can be defined as the communication process in psychotherapy. The communication process in psychotherapy that relies on language as the primary tool for treatment. That relies on language as the primary tool for treatment. And this language, the better one, which is recommended like here in Malawi, we can recommend the native language. Native language. For instance, with the native language like Chichewa, Chitumbuka, when you are talking to somebody who has a problem, you want to communicate with, to him or with him, most or many of them, they would want you to communicate with native language, like Chewa, Tumbuka, native one, being more emotionally connected, because they are more emotionally connected to that. And as well as is conducive to address conflicts as compared to a second language, which is English. Now, a question that could follow could be, how do you analyze this system of interaction? Because there's interaction which will take place between you as someone who is going to relay a message to a receiver. And in this case, you are a social worker, you are a service provider, and a receiver is your client or service user. So there is this interaction that will take place between the two people when you're trying to analyze this system of interaction. Now, how are you going supposed to analyze this system of interaction? Definitely, you look for some methods or strategies which you are going to use when you're trying to analyze interaction within the system. And mainly, you look for the following things. You look for empathy, authenticity, and respect. And apart from these ones, we are also interested to look at the examples of verbal communication. Examples of verbal communication. Verbal communication may include things like email, phone calls, or face-to-face interface or meetings. Are you through with them? Okay. Uh, Having looked at those, because of this problem of, I have some notes about empathy, authenticity, and respect. But because of, I cannot open that PC because of the electricity problem. But in our next class, I'll print those. If not, I printed them already. I gave you those. We are talking about introduction to the system for analyzing verbal interaction. Do you have it there? Okay, you have it now. Let us go straight to working with the families and groups. Have you written that one? Can you read it for me? I want to listen it. Huh? Uh-huh. No, the one I just gave. I've just said working with families and who? And groups. Uh-huh. Now, working with families and groups needs effective communication. When you want to work with a family or families or a group of people, don't forget that this one we're talking about social work skills with social work skills with special population, right? Our main focus or the key words which we look for in this course is special population or groups, and if you can remember very well, when we were introducing this program or this course, we did mention about special population and special groups. Can you give me a good example of those? Refugees, mental affected people, people with mental problems, orphans, women, the aged, prisoners, etc., etc. So these are the groups of people. So it means these people have problems and they are looking for assistance that can be provided by social workers, or service providers, right? Now, it will reach a certain time whereby you would want to communicate with these people, and communicating with them is very difficult. So that's why they are saying working with families or groups or populations requires effective communication. And as we go along, we'll look for the factors that can enable us to have effective communication. Factors that will enable us to have effective communication. We'll look at them. What could be these factors? But now, I want us to look at working with families and groups. That is to say, there's need for effective communication. And for this one, you need, first of all, if you can remember, I did mention about those three at first: empathy, authenticity, and respect. Right now, we are saying you need empathy and facilitation skills. Empathy, you need to be empathetic. At the same time, you need to have facilitation skills. And some of the strategies which the family, with which the social worker is supposed to have when he or she wants to communicate with a family are as follows. One, you are supposed to build trust and rapport with each family member. You as a social worker are supposed to build trust and rapport with family members. If there are 4 of them, build trust and rapport with each one of them. Another strategy which you are supposed to use is you are supposed to identify and respect individual and collective strength. Those, if you are dealing with a family of 4 people or members, identify and respect them and the collective strength. Identify their strength. Where are they stronger? Where are they weak? You need to know their strengths. Identify them. Apart from that one, you're also supposed to foster open communication and active listening. Be an active listener. That's if you want to have effective communication. Foster open communication and active listening. You are also supposed to set clear boundaries and expectations. Definitely, if you're going to set boundaries, so that is to say, when you'll be communicating with these 4 groups of people, you're supposed to be moving within the stipulated boundaries of your communication. You're not supposed to go outside whatever you are communicating. Don't bring new topics. Stick to the topic which you have started communicating with those 4, if it's a family of 4 people. So set clear boundaries, and by doing that, you are also having expectations from whatever topic you have started with them. Furthermore, what are you supposed to look for? You need to apply support, skill building, and empowerment. Support, skill building, and empowerment. Whatever you are doing, try as much as you can to empower them, to support them. And finally, you are supposed to connect those families with resources and services. When you're communicating with families and groups, you need to connect them with resources and services. And don't forget to look into the following things. When you have established that, or you have built that trust, you need to establish a safe and inclusive environment. Establish a safe and inclusive environment. Again, you're supposed to define group goals, which means each and every group, when you're communicating and you want to have effective communication, you need to define group goals as well as expectations. What are you expecting from any group you're communicating to? You need to encourage participation and engagement. If you want to have effective communication, try as much as you can to encourage participation as well as engagement. You need to engage people, Which common strategies are you supposed to use when you are communicating with people, with families and groups? There are some common strategies, methods. There are common methods which you are supposed to use when you're communicating with families and groups. We are talking about to have effective communication. When you're talking or we are communicating with families or groups. Common strategies that can be used. The first one or the first strategy is be flexible and adaptable. Be flexible. When you are communicating with families or groups or special populations, you're supposed to be flexible. Be flexible. Again, even if probably you have identified that the group of people you're talking to, the group has got some problems, clear problems, don't use judgmental language and approach. That is to say, use non-judgmental language and approach. That's one of the common strategy when you are communicating or when you want to have communication, effective communication. Use non-judgmental approach or language. Don't blame any member. Show, strategy number 3, show empathy and understanding when you're communicating with a family or special populations. You are also supposed to use evidence-based practices and interventions. Remember, we are working with families and groups which require 1, patience, understanding, a willingness to adapt to unique dynamics and needs. I don't know if there is any question on that one. If you don't have any question, then we should go to another point. Should we go to another point? Working with young offenders. We are looking at working with families and the groups, but now we want to work with young offenders. Young offenders, probably they can come from families or from groups, but we are talking about working with young offenders. Do you know the meaning of offender? An offender? Okay, those who commit crimes. So we're talking about the young ones, the minors, fine. So working with such kind of people requires a compassionate. You as social worker are supposed to be compassionate, and again you're also supposed to use multifaceted approach when you are dealing with these young offenders. You are supposed to be compassionate and also to use multifaceted approach. So there are several strategies that can be used when communicating with young offenders. The first strategy to be used is build trust and rapport. That is to say, you as social workers are supposed to establish a positive relationship to help these young offenders feel comfortable opening up. So you're supposed to build trust and rapport. By doing that, you want to establish a positive relationship to be there between you and them, so that you should easily help them feel comfortable opening up. Another strategy, you need to identify underlying issues. When you are dealing with young offenders, you need to identify underlying issues. What are these underlying issues? That is to say, you need to to address the root cause, or to find out the root cause of their behavior. Why have they behaved the way they have done, so much so that they have reached the extent of offending. So you need to identify underlying causes of the root cause of their behavior, such as trauma, mental health, or substance abuse. Why have they started reaching further? You are also supposed to set clear boundaries and expectations. That is to say, you are supposed to encourage accountability and responsibility. Encourage accountability as well as responsibility. You are also, when you are communicating with young offenders, what are you supposed to do? You need to create a supportive environment. Create supportive environment. That is to say, you need to provide access to education. Apart from that one, what else are you supposed to do? You need to bring counseling, you need to counsel them, and even you need to play a positive role. And you are also supposed to act like a role model. Play a role model role. Play a role model role. You are also supposed to encourage skill building. Encourage skill building. By doing this, you're going to help them develop life skills, vocational skills, and even positive coping mechanisms. That's very important. You are also supposed to focus on rehabilitation rehabilitation. That is to say, emphasize personal growth and reintegration into society. Focus on rehabilitation. You need to focus on rehabilitation. That is to say, you are supposed to emphasize personal growth and reintegration into society. So I don't know if there is any question on that one, working with young offenders. Yeah, working with young offenders. Is there any question? Let us move on to another point. This one is talking about communicating with people with mental health challenges or problems. You as social workers, definitely, expect this to take place to you. I mean, when you'll be working, it will happen this one. You'll be working with people with mental challenges or problems. Now, communicating with such kind of people is not all that easy. It requires empathy, understanding, and effective communication skills. So the requirements are for empathy. You as a social worker is supposed to be empathetic. You are also supposed to understand and to understand and also to come up with effective communication skills. So since we have said communicating with such people requires empathy, what are you supposed to do? One, listen actively. You're supposed to listen actively. That is to say, pay attention to their words, not only their words, but even their tone and body language. Listen actively. So when you're in the process of listening actively, you're supposed to pay attention to their words, their tone, and even their body language. Another effective communication skill which you are supposed to use is use non-judgmental language. Use non-judgmental language. Remember, you are talking to people with mental challenges, mental issues, mental problems. So use non-judgmental language. That is to say, you are supposed to avoid stigmatizing or labeling language. I hope you understand what I mean. So use such kind of a skill. Be non-judgmental. Be non-judgmental. Again, when you are communicating with people with mental health, you're supposed to show empathy. Show empathy. That is to say, you need to validate their feelings. You need to validate their feelings and even acknowledge their experiences. You need to acknowledge their experiences. Acknowledge their experiences. Apart from that one, you need to be patient when you are dealing with such kind of people. That is, be patient. You need to be patient with them. That is to say, by being patient, it means you're supposed to allow them to do what? To share information at their own pace. Don't tell them if they are slow, the pace of narrating their story is slow. Don't force them to be fast. Hey, don't be like that. Let them share information at their pace. Don't at your own pace, but their pace. Again, you are also supposed to use clear and simple language. When you're communicating with such kind of people, you are supposed to use clear language as well as simple one. This one will help you to avoid complex or technical terms. You are avoiding, if you use simple language, it means you are running away from using technical jargons, technical terms, or complex terms. Again, when you are communicating with such kind of people, what are you supposed to do? Avoid giving advice. Don't, I repeat, don't give them advice. Instead, what are you supposed to do? Offer support and resources. Offer support to them and resources. But don't ever try to give them advice. Don't give them advice. Again, what are you supposed to do when you are communicating with people with mental health? Don't push for information they are not ready to share. This is the one which I just said. Don't force them. That is to say, you're supposed to respect boundaries. Learn to set boundaries. Again, here you are also supposed to recognize the impact of your position or role. You have a position which you are playing, a role which you are playing. So that role which you are playing or which you are displaying during that particular moment in time, it means you are in power of controlling your communication. Therefore, you are supposed to be aware of that. Be aware of that because it has a certain kind of impact. Because you are leading the role, the show. You are controlling the show. So please try as much as possible to be aware of power dynamics. That is to say, recognize the impact of your position or role. When you are also talking to such kind of people, you need to control your emotions. You're supposed to control your emotions. Control your emotions. Your emotions and sometimes even stress. Control your emotions and stress when you are talking or you are communicating with such kind of people. I don't know if you have any question you can ask. You can ask if you have any question. You don't have any question? Are you sure? Sangonena mulinalo, but you're failing. Let us look at another point, which is talking about working with vulnerable older people. Is that so? Let me check if I'm supposed to go to that one or the other one. No. Now, let us have a look at working with vulnerable older people. Vulnerable. What does it mean by the word vulnerable? Some say vulnerable. I'm coming. Can you find out for me these ones? Look what, define this, define, define, put them down, put them down. Put them in writing. Posisha kita hapa hii. ngati china ndiphereso ndi mwayiso chifukwa yokumapangana gulu lako linaliyenda libweza. Munali kuti ati mwakadi chips. The topic is saying what? About what? Communicating with upanga zomwezi. You are consulting Mr. AI. Zoenda. Okay. Come, where's pause here? Nabasipambirira okupanga zimene when we start, where's pause? In this one? Pause indeed.
I think this one I've never paused.
Wait, let me pause. Now, can you explain to me what have you found?
Okay, vulnerability.
Remember, we are trying to communicate with the vulnerable older people. Yeah.
So, vulnerability refers to the state of being exposed to the possibility of being harmed, either physically or emotionally.
That's the vulnerability. Fine. And vulnerable people. Examples of vulnerable. Who are they? I want you to mention them.
Vulnerable people, these are individuals or groups that are at a higher risk of experiencing harm due to specific factors in their lives. Some of the examples of these vulnerable people, migrants and refugees.
Migrants and
Refugees.
Refugees.
Low-income families. Individuals with disability. Elderly people. And children.
Okay. Just to mention a few. Now, what are the factors that make these people to be called, to be regarded as vulnerable? That make them to be vulnerable?
Some of the
What?
include lack of resources.
Lack of resources. Like who?
Like the children.
Children.
They may not have someone to take good care of them. Since some of them they might like caregivers.
What about those who are having low what income?
Yes, those who also have low income, they cannot afford to have some resources.
What about the migrants or refugees? Why do you think they are vulnerable?
The refugees, they might have limited opportunities. Since they might be
Access to resources sometimes in the host country is a problem. Fine. What about how can we deal with their vulnerability? How can we deal?
the children.
How can we do with these people you have mentioned here? Either these, each one of them.
Financial assistance programs. Whereby be provided with housing, like those refugees, they might not have a proper house for them, and even those from low income, they might not afford to have food for their daily basis. So they are supposed to be provided with the financial assistance programs.
Fine.
Job training and education. They should be offered free job training programs and scholarships for them to further their education. Like we have said, the children, those who come from low income families, they might have the caregivers, but they cannot afford sending them to something. So they have to be provided scholarships.
Fine. Let us go back to you've mentioned about vulnerability. Fine. Types of vulnerability and also indicators of vulnerability, because you've also mentioned about factors that can contribute to vulnerability. Have you talked about this? No.
Yes, dependency, health issues, social isolation, stigma, limited opportunities.
What about the types of vulnerability?
Types or indicators.
Types. Before we go to indicators, there are types of vulnerability. Hey, you need to search for that one. Look for that one.